itself for a further surge in COVID-19 cases. The Western Cape still has the most number of those infected. So just how have the hospitals in that province been affected, and how have the healthcare workers also been affected? Early in the pandemic, we spoke to Dr. Usha Lalla, who is the operational head of the COVID-19 ICU at Tygerberg Hospital in Cape Town. She joins us now live. Dr. Usha, good evening, and thank you so much for your time on the pulse. Tygerberg in particular has been facing quite a number of different issues during this period of lockdown, and where we're watching the increasing rate of infection. Give us a sense of what operations at the hospital are right now.
You know, I must say we sort of settling down, and we've got into our rhythm a little bit. You know, Tygerberg feeds or is a referral hospital for one of the major hotspots in the Western Cape, so we are quite inundated with patients initially. But I think with great teamwork between all the hospitals throughout the province, we're not absolutely overwhelmed, and I think that's a message that we need to get out there. From an ICU capacity, we've certainly increased our capacity a hell of a lot. But, you know, about 5% of the general population will require critical care, which doesn't really sound a lot. But if you take into consideration what our entire population is, it works out to be a lot of patients. With our limited ICU beds, this does become a problem. We have increased our capacity, just not in terms of spaces and beds, but basically across the platform with human resources, the nurses, the doctors, the equipment, and everything that is required to successfully provide a critical care service as much as we could.
Dr. Lalla, of course, some of the allegations that you faced in the last couple of weeks have also been from unions who've said that Tygerberg Hospital is, you know, the hospital itself is a hotbed and a hotspot of COVID-19 infections. And they were referencing the number of healthcare workers that have tested positive at that hospital.
You know, I think everything is about perspective, Cathy. You know, Tygerberg Hospital is one of the biggest hospitals on the African continent, I think after Baragwanath, and there are a lot of people working here and throughout the hospital. And obviously, you know, the infections, the staff that works in the hospital, they, you know, can come from communities where COVID and coronavirus is quite prevalent as well, because it's throughout the Western Cape. So, you know, the hospital itself is doing its utmost best with all its protocols and policies in place, in ensuring that, you know, we're up to standards in terms of PPE, training and teaching, and trying to maintain and protect our staff. Unfortunately, human nature does play a part in it as well. And, you know, it's a massive hospital, and I think our percentage in terms of how many infected from a hospital staff point of view is you know, correlates pretty well with that internationally, as well as in other hospitals around the province and probably in the country as well.
Have the issues over PPE that had raised and were the motive behind several protests that took place at the hospital, have those been addressed? And, you know, this is very important, especially for a division like yours, the ICU division.
Yeah, you know, I'm not going to lie and say, you know, there hasn't been challenges, but I must say the hospital management and Tygerberg, we've done our utmost best to ensure that PPE is available with the appropriate training and protocols and policies and everything that we constantly reinforce throughout. You know, there are there are multiple challenges from supply from international companies, getting it to the hospital, getting it to the wards. These are the operational issues that I think every hospital will affect. But, you know, there's always a way to work, and thus far, you know, there has been a general shortage, but we were able to work around it and provide our PPE for the staff as best as possible.
Let's talk about this increase in capacity and the state of the healthcare system, and especially for an institution like Tygerberg Hospital, when it comes to the number of people that you're having to admit to your hospital who, of course, then need more care as a result of COVID-19. What does that look like right now? What is the number of beds that you've made available? Do you still have capacity to take in more people?
Yeah, no, certainly. Initially when the whole pandemic started, from an ICU perspective, we envisaged that most of them would require mechanical ventilation. We've managed, so for example, our ICU, we started off with 7 beds, and we've increased our capacity by at least 5 or 6 times in terms of mechanically ventilated beds. The use of high flow in our hospital and now throughout, I think, most of the province has increased that capacity dramatically, because we can actually use these machines and this way of ventilating patients in the wards, which obviously increases our capacity as to how many critically ill patients that we can manage in our wards. Although the ICU beds itself are quite limited, the use of high flow has certainly made us or enabled us to manage many more critically ill patients throughout the hospital at the moment.
One of the conversations that has been had across the country, and in a way of trying to get people to understand how serious COVID-19 is around what happens when you have the system becoming overwhelmed and more people needing perhaps ICU beds than what is available. And I wonder if you at Tygerberg have been in that position yet, where you've had to make calls around who gets a bed and what actually are the measures that you're applying, if there's a process that you're applying in making those decisions.
Yeah, there is a critical care triage document that basically is a document looking at how we'll allocate beds in terms in an ethical and structured way, which is present and used throughout the province at the moment. But from a Tygerberg perspective, we were quite lucky. We haven't really got to that point where we can say, we are at full capacity now, we are not accepting any more ICU, or we cannot accept any more critically ill patients. And I think a large part of that was, the working between the teamwork between the hospital and the referral hospitals that generally will send their patients to our unit. The regional hospitals and the district hospitals have also increased their capacity to manage these patients quite significantly, which has taken off the burden of Tygerberg in terms of just not beds and equipment, but resources, human resources, doctors and nurses, cleaners and porters. So the load is actually is focused at Tygerberg Hospital, but the load is actually spread throughout the province at the moment, and Grootskeur as well, which is the other tertiary hospital in the province.
All right. Well, thank you so much for coming on to the show tonight and painting a picture of what things look like. Dr. Usha Lalla of the COVID ICU at Tygerberg Hospital in Cape Town. Well, coming up, some news for parents of little ones. The courts today pronouncing on the reopening of private preschools. I'll give you all the details shortly. Do stay with us.